Welcome back, I'm Dr. Andrew Dixon of Business Health. This is the second part of the talk on medications for anxiety and depression. I'm not going to talk about the medications that we use for some of the more, even more serious conditions such as bipolar, OCD, or particularly the psychoses. Keep it simple. The most common medications to be prescribed are the antidepressants, which, as we've said, can be used both for depression and for anxiety. The other medications which are commonly used are beta blockers and a group of drugs called benzodiazepines, of which diazepam, Valium is the best known. And I also want to talk about sleeping tablets. So let's look at beta blockers. Beta blockers can be very helpful in helping to settle the symptoms of severe anxiety. If somebody's having very frequent panic attacks, or if they're feeling very anxious throughout the day with a lot of physical symptoms, beta blockers are particularly helpful for the physical symptoms of anxiety and worry: shake, heart beating fast, sweating, physical feelings associated with anxiety. There's some evidence that they help also centrally in the brain with reducing anxiety, but their principal effect is in reducing the physical effects. So a musician, for example, who finds his fingers are sweating and shaking as he goes on stage might benefit from having some beta blockers, at least to start with, until he gets used to performing and being in that situation, and then the brain will actually reset itself. Beta blockers are generally safe. They reduce blood pressure, however, and they sometimes give people bad dreams, sometimes quite vivid dreams, and they can have quite significant effects on sexual libido and erectile competence. So there are side effects to all of these things. People who should not take beta blockers are people who have cardiac failure, unless it's under their direction of their GP or cardiologist. Sometimes beta blockers can actually paradoxically be helpful in cardiac failure, and people with asthma. Any suggestion of asthma you should certainly discuss with your GP whether these drugs are actually going to be appropriate for you, because they can make asthma very much worse. So that's beta blockers, can be very helpful in settling particularly the physical symptoms associated with anxiety and worry, possibly some effect on the actual mind side of anxiety as well. Be careful in asthma, and absolutely not to use in cardiac failure. When in doubt, discuss with your GP. Let's look at the benzodiazepines, of which the most well-known example is Valium, otherwise known as diazepam. The generic name is diazepam. Very effective drug for helping with anxiety. The downside of Valium, diazepam, is twofold. Firstly, it makes people a bit sleepy. Secondly, it's highly addictive. People who get used to taking diazepam find that it's very helpful to start with, but they feel a bit sleepy. The second step is that they don't feel sleepy and it's still very effective. Then, unfortunately, the body starts to get used to it and the anxiety creeps back in, and you find yourself sometimes needing to take higher doses of diazepam in order to get the same effect as you might with street drugs, for heroin or crystal meth or any of the other common street drugs, finding yourself needing higher doses to get the same effect. And eventually you find that you're actually hooked on the stuff and you're getting some anxiety in spite of fairly high doses of diazepam, and any time you try and come off it, the anxiety is just that much worse. So as a general rule, unless you've got very severe anxiety, better to stay off this group of drugs altogether, in my opinion, but of course something for you to discuss with your general practitioner or specialist if you're seeing one. Good drugs, though, for the very short term, if you've got a flight to take and you're flight phobic, some Valium in the waiting area before you get on the flight could be really helpful, and the soporific effect could also be useful in that you'll be more inclined to sleep on the flight than to stay awake worrying. But, and they can also be used at night, but there is a little bit of a hangover effect, so although they may help with rendering you unconscious for longer at night, the actual therapeutic sleep may not be that good. Don't confuse time spent unconscious with time of productive sleep, and there may be a hangover effect in the morning. So be particularly careful with Valium and that group of drugs if you're in some sort of safety critical role, driving, particularly driving a bus or a large vehicle, working at heights, working on cranes, driving trains, or driving at speed, for example, in the emergency services. Make sure that your GP, and preferably if you have an occupational health service, your occupational health physician knows that you are taking or proposing to take this group of drugs. Finally, let's move on to sleeping tablets. Sleeping tablets can be looked at in a very similar way to the benzodiazepines like Valium. They can be very helpful in the short term, but again, there can be confusion between the amount of time apparently spent asleep, which is actually time spent unconscious, and time spent actually having restorative sleep. Many people find that that their sleep quality is not as good as they had hoped with drugs like temazepam, for example, or the Z drugs, Zopiclone, Zolpidem, and other drugs of that class, which are not actually benzodiazepines but very closely related. And unfortunately, they don't stop working at 6 o'clock in the morning. So when you get up, even if you've had a good night's apparent sleep, you've got the chemical effect of the medication hanging on afterwards. And that can be really quite unpleasant. Apart from the safety side of it, it can add to any depression that you're feeling, as can the effects of diazepam, Valium, throughout the day. And there's some evidence that it actually slows up the recovery from depression while helping in the short term with sleeplessness or anxiety. So I think that there have to be quite good reasons to take antidepressants in the first place. If you're taking an antidepressant, my preference is generally to look at a non-sedating and non-sleep-making antidepressant. Have a very good discussion with your general practitioner before you consider taking a sleep-making antidepressant because of the soporific effect in the daytime. Beta blockers can be helpful for the management of anxiety, particularly the physical components of anxiety, and perhaps some effect on the anxiety itself. They're not addictive. Drugs such as Valium, diazepam, and other drugs in that group can be helpful in the very short-term management of anxiety, but are generally prescribed only for a few days or perhaps a couple of weeks, and in my view have the greatest case where somebody is actually facing a phobia such as flying, where they could be particularly useful. Take one or two, then put them away for next time. And then the sleeping tablets, in my opinion, best avoided in anxiety and depression. Generally better to find other ways of managing sleep problems, which we'll be talking about in another talk.